I'm Adrienne Corbacus. I'm the Chief Operating Officer here at Community Crisis Services. And the mental health liaison position really started in this area probably around 2017. Community Crisis Services got their first liaison in, I think it was August of 2021 was when we started with our partnership with the Iowa City Police Department. Co-responder programs are pretty popular across the country, and there's a few different models. Some involve law enforcement hiring their own individual to serve within their department. Some also involve the collaboration between a crisis services agency, which is what you see in the models here locally. We recognize that individuals sometimes come into the mental health system through law enforcement, and so we really wanted to add an additional point on the continuum of crisis services to allow for individuals to get the right level of support to meet their needs. So we have our crisis lines, we have our mobile crisis response teams that respond without law enforcement, but we also recognize that we were missing a group of the population who are entering the mental health system through law enforcement. And so in those situations, it's really nice to be able to embed a crisis counselor with law enforcement to get those individuals the services that they really need. We do have a mental health liaison that's been embedded with the Iowa City Police Department since 2021. This position that we're adding is a little bit different because our co-responder will be shared between 3 different departments. So they're shared between the Johnson County Sheriff's Office, the North Liberty Police Department, and the Coralville Police Department. And what we found with these programs that a lot of success comes from being able to build successful relationships with the officers and with the staff at those entities. And so I think that when you're shared between 3 departments, you have that many more relationships to build, you have that many more people to get to know. Through our work with these liaison programs, we've recognized that every department is a little bit different, the culture there is a little bit different, the people are a little bit different, and so I think that when you're shared between 3 entities, you just have to get to know that many more people and learn that many more things about how things work. The other difference that I really see between the liaison with the Iowa City Police Department in this position is that they cover all of Johnson County, which includes some rural parts. So we know that serving individuals in rural areas sometimes looks a little bit different than serving people in urban areas. And so there are less resources available, there's sometimes transportation issues. And so I think that that's another challenge that we see with the liaisons serving, rural areas versus urban. So when we think about the 988 crisis line, that option is really diversionary from law enforcement. So it's an option for individuals to call where they can talk with a crisis counselor and law enforcement is not involved in those interactions. That being said, 988 is a really great resource for individuals, and so I anticipate that our liaison will definitely be giving that number out and educating individuals who might be calling 911 for their mental health crisis that there's this other option available for them that doesn't include a law enforcement response and is probably better suited to serve their needs. The public has been really excited about these programs. I think that people recognize that there's a need for kind of a continuum of care when it comes to crisis services and that we need different options for people who have different needs. And so these co-responder programs, I think, are filling a gap that previously existed where we had individuals that maybe had needs that were more complex or that were coming to us through 911. So I think that people have been really excited to see that there's this other point for individuals to receive the services that they need. All of the departments that we have worked with have been incredibly wonderful partners. They have been excited to have the additional support and the additional help within their departments. And I think one of the pieces of feedback that we often get with these programs is that, 6 months or a year in, departments are questioning how did we ever function without this role, because they just are able to do so many things to provide that support. So we've learned a lot in our time with these liaison programs, and I think one of the biggest takeaways is that every department operates very differently, and so we have to have a lot of flexibility in these programs so that we're able to meet their needs effectively. We've also learned that probably the most critical piece to the success of these programs is the person in these positions, their ability to build relationships with law enforcement, to build relationships with other community providers, and to build relationships with the individuals that they're working with and providing services to. Going forward, we're really excited. We are going to be having another liaison joining our team out in Iowa County. So it's a shared liaison between the Iowa County Sheriff, the Williamsburg Police Department, and the Marengo Police Department. We're currently interviewing for that right now. So once we get that position in place, we will have liaisons with all of the law enforcement entities within Iowa and Johnson County, which is really exciting to see.
My name's Kieonna Pope. I was born and raised in Ottumwa, Iowa, graduated from there. I moved up to Iowa City and got my degree here at Iowa. After that, I moved back home and became a caseworker, youth care worker for a shelter program and a juvenile delinquent facility. And that's kind of where I started my journey with mental health. I dealt with a lot of kids that struggled with a lot of mental health issues, and there wasn't a lot of placement options for them besides a shelter. And so the more I kind of worked my way up, I became a sexual assault advocate for about 4 years for crisis intervention services in Southeast Iowa. That's where I really fell in love with mental health, the court process in the system and how that goes. And then I was looking kind of to move broader and just kind of take my career to the next level. And so when I read the description of the job, it entailed everything that I have been doing, and the fact that I'm working with law enforcement, partnering with them was a big part of the decision of becoming a mental health liaison. So my area of coverage right now is North Liberty, Coralville, and the Johnson County Sheriff's Department. So the more the rural areas like Oxford, Lone Tree, Tiffin, Solon, those places. Me being stationed out here in North Liberty, located kind of in the middle as well, so it's a little bit easier, but I think they just decided because they had an extra room for me that I'd be placed up here. With the other mental health liaison, he covers one specific area, so he's able to respond very quickly because he is stationed right there. Because I cover such a large portion of the area, right now they dispatch me out to what they think is a mental health call, and I meet them there. Or if I'm riding along with the officer, we take those mental health calls. Eventually I'll get my own number, my own radio, so dispatch can dispatch me out to wherever they need me to be. That's kind of what we're looking at right now. So in the office, typically I start my day with checking in on my emails. A lot of times, because I cover such a large portion of the community, a lot of the different officers will send me emails about what has happened maybe during the weekend or during the hours that I'm not working that they believe is mental health related. So I follow up with those clients. I get more information from the police officers if this is something I can follow up on my own, or is this something that they need to come with me. So I do those follow-ups, kind of plan my day around that, and when I have time, I hop in the car and I ride along with the officers and I help with those mental health calls that are acute and right away. Before I actually started out here, I trained under mobile crisis, so I was able to get a good idea of kind of the members of the community, kind of what I will be dealing with mental health wise. I got to shadow the other mental health liaison, which was a lot more acute and more intensity type work, but overall it's been going good. Everyone's been welcoming out in the community. People don't know me yet. If it's not something criminal and they just need to talk, it's easier for them to talk to me than to talk to somebody sometimes in a uniform. It can be more intimidating to them, or they could have had a bad experience, so I'm able to kind of take that over. It will be a lot better for me to get out there and get those resources for those clients, and for them to kind of listen more and build that rapport. Inside the PD, they've been very welcoming and kind of taken me in as one of their own, and so that makes me feel really good and welcomed.